Some breaking news to bring you now. We've had new data in, which has been published, detailing the disruption to NHS care caused by strike action by hospital consultants in England last week. They walked out for 2 days in an ongoing row with the government over pay and working conditions, which has been going on since last December. And we can go now to our health correspondent, Ashish Joshi. Of course, every time there's industrial action in the NHS, Ashish, it causes such a lot of concern for people who are sick or awaiting operations. And we now know the impact of the latest industrial action. Tell us more.
We do know the latest impact. We have the latest numbers released by NHS England, Sally. For the last 2 days of industrial action, that's the 24th and 25th of August, 45,827 cancellations to procedures and operations. These are routine procedures, but not routine for the patients who need them, anything but. 6,000 staff were off over this period. During the industrial action, and that brings the total number of cancelled operations since December last year, when the industrial action in the health service first began, to 885,154. And what's concerning now for the Health Secretary, the government and the NHS and trust leaders is that the resolution to the doctors' strike, the junior doctor strike, and the consultants who are striking as well, there is no resolution in sight. The two parties, the BMA, the union representing these junior doctors, and the Department of Health and Social Care, remain as far apart as they have been throughout this bitter dispute. If anything, the two sides are becoming even more entrenched. We have the junior doctors' ballot results, which will be released on Thursday. We expect that this will be another mandate for more strike action. Junior doctors will get at least 6 months if they do vote, which we expect them to, in favour of strike action, another 6 months, which will take them way into the winter. And the consultants already have a mandate which extends their strike action until December. So what we're looking at is an extremely busy period through autumn, leading up to the critical period over winter, when hospitals and the NHS are at their busiest, with junior doctors and consultants striking. So this is an extremely difficult challenge for the NHS, a challenge for the government, and really all sides urging some sort of breakthrough for the government and junior doctors and consultants to come back to the negotiating table and find a way through this, because ultimately thousands and thousands of patients are suffering, and the longer they wait for treatment, the sicker they become.
Yeah, and of course, more industrial action scheduled. Ashish, for now, thanks very much indeed.